Hello, everyone. Welcome back to our CA assessment. This time we have batch 2 for their pattern differentiation or syndrome differentiation, week 1. This week we shall be grilling them on pattern differentiation according to the 8 principles. Let's start with Dr. Janine.
Yes, Doc. Good evening. Good
Good
evening,
evening.
everyone.
Evening.
Yeah, can you tell us about the 8 principles or the 8 guiding
Guiding,
principles? Just an overview.
the 8 guiding principles on patterns, how we are supposed to diagnose. The classification would be the yin and the yang. We should look for the location, which is whether the invasion is interior or exterior. If the nature of the problem is heat or cold, and if the strength is if it's an excess or a deficiency pattern.
Okay. Can you see some? Yeah, thank you so much. That's good. Can you see something on your screen, guys?
Doc, just your folders.
I'm sorry.
Just
I'm
your
so
folders.
sorry. Yeah, I'm sorry about that. Sorry.
It's
There.
okay, no?
I was
There.
on my monitor. Okay, sorry. There. Yeah, so Dr. Janine was saying the 8 guiding principles are used to analyze the clinical data through 8 syndromes to be able to diagnose the location. So when we talk about the location, we try to differentiate if it is exterior or interior. If it's according to nature, we determine if it is hot or cold. And then if there's a conflict between the anti-pathogenic factor and the pathogenic factor, the one causing the disease, that's excess or deficiency, and classification, yin or yang. Thank you so much. So exterior and interior are used to describe what aspect of the disease?
The exterior is the skin, the muscles, the channels, and the collaterals.
Okay.
While the interior, the Zang organs, the blood vessels, and the marrows. And the bone marrow, sorry.
Okay. I'll just show this to them, but because they might not, because I think earlier this wasn't shown. Sorry for that. Okay. So when we talk about the exterior and interior, so this refers to the location and the depth of a disease. Okay. Just by looking at the tongue, we can immediately tell, and also the symptoms. Okay, what is the exterior syndrome concept?
The exterior syndrome refers to the symptoms at the primary stage of exogenous diseases caused by the invasion of the 6 evils into the body through skin, mouth, and nose.
Very good. Thank you. What causes it? What causes an exterior syndrome?
Invasion of 6
I think
evils.
you already mentioned it.
Oh, okay.
Invasion of the 6 evils into the body through the 3 portals: skin, mouth, and nose.
Nose.
So,
This
yeah.
is the lung organ.
Yeah. Yeah, very good. Because the skin is considered to be the 3rd lung. Number 5, what is the main pathogenesis of exterior syndrome, or how does this disease develop here?
The defensive chi fails to disperse. When the defensive chi fails to disperse, the lung chi fails to descend and tama ba, Doc? Ganun
Yeah,
ba?
of course. Because the lung chi, I think the lung chi controls the wei chi or the defensive chi. So makes sense. So if you have weak lungs, then definitely you cannot disperse the defensive chi. Okay. And then what else? Like how do the manifestations come about? When there is
Manifestations, Doc?
yeah, when there is meridian chi stagnation.
Stagnation.
So basically, when you talk about the exterior syndrome, we're more particularly concerned with the channels or the meridian. Okay. So if the defensive chi is too weak, it cannot disperse the pathogen. It cannot really get rid of the pathogen. Okay, so there is now a conflict between the PF or the pathogenic factor and the APF or the antipathogenic factor. This is like the immune system, no? So what are the main clinical manifestations of an exterior syndrome?
There's aversion to cold or wind. There
Okay.
will be fever,
Yes.
headache, general body aches, superficial floating of pulse, and thin and white coating, tongue coating.
Yeah. An exterior syndrome has a sudden onset. Okay. Sudden, short duration, and it has a shallow location. That's why looking at the tongue is very, very important, and also the pulse. There is aversion to cold or wind. There is fever. There is headache, general achiness, superficial pulse, because superficial is exterior. You're not supposed to feel anything superficially, right? You're supposed to feel the pulse middle level. But this time, if the pulse is superficial, then it's definitely exterior. Thin and white tongue coating. So there's nothing wrong with the tongue, tongue coating at all. That's a normal tongue coating. There is nasal congestion. I think I can relate to that. Sneezing. Oh, I've been sneezing on the plane. Itchy or sore throat. Yeah, coughing. Okay, exterior disease is characterized. I think I mentioned this earlier. I don't need to ask you that. It has an acute onset, mild symptoms, and a short duration. So what are all the exterior syndromes?
It's wind cold, wind heat, wind dampness, and exterior deficiency.
Very good. Wind cold, wind heat, wind damp, wind dry, dryness, and exterior deficiency. If you notice, the wind would accompany the pathogen. So there is always a partner. Okay, let's talk about wind cold. What are the causes and characteristics of the wind cold?
Causes external wind cold pathogen. Characteristic is aversion to cold, feeling chills, less fever, no sweat, absence of thirst, itching throat, superficial and tense tight pulse.
Okay, very good. Okay, I would like you to get used to looking at the tongue first and feel the pulse. So, especially when we have exams, you won't get lost if you look at the tongue first, no? So, tongue here, tongue thin white, but moist. Okay, it should not be moist. So when it's moist, it's definitely cold, wind cold. And the pulse is superficial and tight. Tight is cold. Okay. So there is more chills and more aversion to cold, less fever, because that's wind cold. But there is still fever. It's just that the chills and the aversion to cold are more prominent. No sweats. You don't sweat during cold. Okay, there's absence of thirst, and there's itching of the throat, headache, and general achiness. Now let's go to wind heat causes. Oh, I see Mom Erdeles. Thank you for coming. Finally, we have three. Yeah, finally we have three. Yeah. Wind heat this.
Causes is external wind heat pathogen. Characteristic is there's more fever,
Okay,
sore throat, red tip and side of tongue body, thin white and dry coating or thin coating, could be thin coating, and slightly yellow coating. And the pulse is superficial, floating, and rapid.
very good. Rapid and superficial. Rapid is heat. And okay, when you look at the tongue, red tip and sides of the tongue. Actually, you don't normally, you don't usually see red tip and sides. It's there are prickles, there are spots on the sides and the tip. Okay, and this is one of the instances where the symptoms are very, very important. So if you notice, if you observe here, there is more fever, less chills, and less aversion to cold. There is thirst. If it's wind cold, there's no thirst. Occasional sweating, sore throat instead of itchy throat. Okay. I think, okay. Thin white dry coating or thin slightly yellow coating because yellow is heat. Floating again because it's superficial and rapid. What are the causes and characteristics of an exterior deficiency syndrome? So this time we, yeah.
A cause is external wind pathogen. Characteristic is aversion to wind, sweats, superficial floating, and moderate pulse.
Okay, very good. So the cause is exterior or external wind pathogen. Okay. So this is causing an exterior deficiency syndrome. There's aversion to wind, slight fever, sweats, floating, and moderate pulse. Now let's go to interior syndrome. We're done with exterior. What is the concept here? Like, what exactly is an interior syndrome?
This is a syndrome that refers to the disease inside the body,
Okay.
such as Zang organs, chi and blood, bone and marrow.
Okay,
It
so these are the elements. Okay. Interior, inside, Zang Chi, blood, bone marrow. So it's more interior. What are the causes of interior syndromes? How does it come about?
Exterior syndrome enters interiorly. External pathogens attack Zangfu organs. And it could also be emotional factors, proper diet, strenuous activities, directly damaging Zangfu organs.
Very good. Okay, I hope everybody heard that.
Emotional factors, though.
Yeah. So as much as possible, we do not allow an exterior syndrome to get into the interior. Do not allow it to interiorize, okay? So, or it can be caused by external pathogens that will attack the Zangfu directly. Later, you will find out why examples of such conditions. Emotional factors, no? So let's not let be let's we should not be affected by our emotions. Okay, improper diet, strenuous activity that will damage your Zangfu organs directly. So what are all the interior syndromes?
It varies from interior heat, interior cold, interior excess, and interior deficiency.
Very good. So I hope I'm sure everybody got that. What are the syndromes of interior heats? Manifestations of interior heat syndrome.
High fever, thirst, yellow scant urine, constipation, irritability, agitation, delirium, unconsciousness, yellow coating in the tongue, and a deep pulse.
Okay. If you notice, this time there is no cold or chills. Okay. There is only fever, high fever. So this time the patient will throw away the blankets. No? Thirst, yellow scanty urine, constipation. So usually the patient would not come to us for consult. They would usually go to the hospital. Take note of this: delirium, unconsciousness, yellow coating. So if you have a patient who started out with exterior heat syndrome and you happen to have these manifestations, then probably you were not actually treating the patient. That's a challenge. Okay. Yeah. So we do not want this to happen. Okay. Of course, this can be dealt with in the hospital, but again, there is still such thing as Shaoyang syndrome, which you will learn later on. So what is an interior cold syndrome? When you say syndrome, it's a constellation of signs and symptoms.
This would be abdominal pain, which is better with application of warmth or heat.
Yes.
It could be diarrhea, vomiting, white, thick, greasy coating of the tongue, and deep pulse.
Yes. Abdominal pain that ameliorates or improves when you apply warmth. Okay, so that means it is cold, interior.
Okay.
Diarrhea is the spleen is so sensitive to cold. So if you have diarrhea, you have loose stools. That is a sign of yang deficiency of the spleen. And vomiting is a sign of the stomach chi, or the stomach
Rebellion.
rebellious. Yes, so you can have vomiting. Okay, so if one has been vomiting for quite some time, and all you did was just to take medications to offset the symptoms, then probably you might want to look at the, maybe you would like to consider consulting an acupuncturist, just like Dr. Janine. I would rather go to someone who knows a lot about naturopathic medicine. Okay, so when you look at the coat, it's thick, white, and greasy. Okay, and the pulse is deep. That means you don't feel the pulse at the middle level. Okay, this is where we should be able to feel the pulse. Obviously, since this is not exterior, you don't feel any pulse at the superficial. Okay, so it's only when you press too deep when you feel the pulse. Okay, good. Now let's go to Shaoyang syndrome. This is very, very important. What is this, Dr. Janelle?
This refers to the symptoms appearing from an external pathogenic factor at the stage of confliction with the healthy qi or Zeng qi, and pathogenic factors between the exterior and interior faces.
Okay.
Usually, okay.
Yeah. Okay, it's half interior, half exterior. So it's like something went wrong. So look, consider the hinge of the door. The one is going out. Okay. It's usually caused by the external pernicious external pathogenic factor moving inwards and now lingering between exterior and interior faces. Okay, so this is caused by it can be caused by endogenous pathogens moving outward. So it's like they are in limbo. Okay, between the interior and exterior. Okay, so since this is a syndrome, we expect a lot of symptoms and signs. So what are the clinical manifestations of Shaoyang syndrome?
Alternating fever and chills, fullness and oppression in the chest and hypochondria, bitter taste in the mouth, dry throat, dizziness, blurred vision, reduced appetite, vexation, nausea, vomiting, and a wiry pulse.
Okay, when you talk about the Shaoyang, if we now discuss the acupuncture channels, we
Mhm.
have such thing as the Shaoyang channels, and these are the gallbladder or the foot Shaoyang and the Sanjiao or triple burner or the hand Shaoyang. Okay, so that is why there is bitter taste in the mouth. Remember, gallbladder is as well as the sanja. So it's more of the gallbladder thing. Gallbladder is the yang partner of the liver, remember? So there will be bitter taste in the mouth. Actually, the whole time there will be bitter taste. Dry throat, dizziness, blurred vision, of course, reduced appetite, vexation, nausea, vomiting, and the pulse is wiry because gallbladder. Okay. Now, fever and chills alternating. Can you imagine? On and off. Then you take so many things. No? There will be fullness and oppression of the chest and the hypochondrial region. So that means this is under the avenue or under the realm of the gallbladder, okay, and the sanjiao. That's the Shaoyang channel. So, parang
Mhm.
naging base yung boses ko. Okay, what are the common types of Shaoyang syndrome? Do you have an answer? Okay. You may find this a
Common.
little bit, yeah, so it's like half-half. Di ba kanina, half exterior, half interior. So you see, exterior cold with interior heat. Exterior heat with interior cold. exterior deficiency with interior excess. Exterior excess with interior deficiency. Let me be honest with you. If they've been treating themselves by taking just antibiotics without any consultation, or even if they were treated or maybe in the hospital, so these things can happen. So sometimes you get confused. How come when you look at the tongue, it's red, pero the pulse is slow, no? So that's half. In Weird, no? But interesting. Okay, that's Shaoyan. You see, it's like the yin and yang. Do you see it? Exterior deficiency with interior excess.
Yeah.
Exterior excess with interior
Yes.
deficiency. So what are all the cold syndromes? Do you have the answer to this? Okay, let's give you the answer.
No, Doc.
Excess cold, deficiency cold, interior cold, exterior cold. Ganun lang kadali. Excess cold, deficiency cold. So if it's excess, opposite is interior cold, exterior cold. What are the causes of cold syndrome? Now, this one you know.
It refers to the pathological change, this is what I got, Doc, in the body in which is caused by a cold pathogen invasion or
Okay.
yang deficiency and yin excess.
Okay, that's good. So basically, the symptoms are due to the external pernicious influence cold, or it's actually the cold, which was the culprit here, that invades the body, causing yin excess or yang deficiency. Dalawa lang yun di ba? So when you say it's excess cold, this is the EPI, yin cold, that invades, or overeating raw and cold food. Okay? So if you overeat raw and cold food, so do not keep eating this kind of food if there is excess cold. It just doesn't make sense. So you might even cause cold syndrome. So deficiency cold, that means the cold resulting from yang deficiency. It's a chronic disease with yang qi damage. Okay. What is the main pathogenesis of cold syndrome, or how does cold syndrome evolve? Oy, andito na si Ma'am Mary Jen. We have Erdeles. Okay, there are now 4 of you. So I think we can end on number 25. Thank you. Okay. So what is the pathogenesis? How does the disease evolve here? Do you have an answer? It's okay.
We got wind cold. Ay, mali. Nakuha ko, Doc.
Sige daw. Let's see what you had, what you got.
Wind cold invading the lungs. Don't know. I didn't get
Oh yeah.
yin
No.
pathogen.
Yeah, it should be yin path that will damage the
Yeah.
yang qi. So if you damage the yang qi, you can create a syndrome, cold syndrome. Or there is yang deficiency. Okay, ganun lang. Yang deficiency failing to warm the body. So as much as possible, dapat wala tayong yang deficiency. That's why we have massage, we have ear acupuncture. So we've seen patients whose yang deficiency has, like, it's so easy, no? The patient feels cold, and right after that, we feel that wow, the lower limbs are already,
Circulation is good.
yes. Don't allow your patient to go home if the patient still feels cold. Okay.
Mhm.
What are the clinical manifestations of cold syndromes? So, Sir Victor, please be ready with number 26. Are we good?
Good po, Doc.
Wow. Okay. I love that answer. Okay. Can we continue, Dr. Janine? Clinical manifestation. I think very easy.
Intolerance to cold or aversion to
Yes.
cold,
Yes.
cold limbs, preference to warm, pale complexion, tasteless mouth without thirst, clear and dilute discharge, clear and profuse urine,
Yeah.
loose stool, pale tongue with white and moist coating, slow and tense, tight pulse.
So we have the same source. Okay. I think everyone got that. It's so easy. Next, what is an exterior cold syndrome? Exterior, huh? Bakit siya? Yeah, okay.
Okay. The exterior syndrome refers to the symptoms at the primary stage of exogenous disease caused by invasion of the six evils. Ganun pa rin do. I got the
Okay.
same.
So
Marked by the sudden onset or short duration.
okay, there is serious
Okay.
aversion to cold. So the star here is the cold. So there is mild fever, no sweating, headache, body ache, thin white moist coating. Tingnan nyo yung ano ha, yung keyword is moist. Floating and tight pulse. Remember, exterior, that's floating, superficial, and then tight because it's cold. Simple. And interior cold syndrome. So we're actually differentiating between exterior cold syndrome and interior cold syndrome. Let's see the difference.
The opposite nito, Doc.
Of course,
Ah, no,
yeah.
it's still good.
Well,
No, but it's
what
still
do you think
cold.
would be the basis of like how do we know if it's exterior or interior? It's so easy, right?
It damages the Zang organs, di ba, Doc?
That's why sabi ko sa inyo, you have to look at the tongue and pulse. So it's so easy,
So,
diba? Like exterior is superficial or floating. Ito naman should be
interior is deep.
deep, very good.
Deep. And then the coating would be thick.
Yes. So the same thing, the same clear copy urine, blah, blah, blah. But this time, the pulse is deep and slow. Make sense? Thank you so much, Dr. Janine. Thank you for coming early.
Yes, Doc.
Now let's call on Sir
Thank you,
Victor.
Doc.
Thank you. Congratulations. Thank you. So start practicing. By the way, next week, it will still be the same topic. This time it's mastery. I hope you would be able to start answering week 2. Still, because you know what? This is a very, I think this is where a lot of people would, like if you are really good, you should know pattern differentiation using the 8 principles and also the Zang organs is easy. There's also pattern differentiation due to CHG, the pathogenic factor. Okay, so yeah, thank you so much. I know it's like this is just the first session, so we decided that this should be done for 2 weeks. Thank you so much, Dr. Janine. Okay, Sir Victor, it's now your turn. What are all the heat syndromes? Can you show your camera? Can you show your video, your face, Sir Victor?
Dok, wala akong camera
Sige, okay lang.
sa
Kayo
PC.
talaga. Okay, sige po. Excuse me.
Yung nakuha ko lang sagot, ito. Exterior heat syndromes and interior heat syndromes, she or su.
Okay, tama yun. Excess heat is another term for she heat, right? Deficiency is shu heat. Deficiency heat is also called empty heat, right? Remember, and interior heat, you know what it is, an exterior heat. Okay. What is the main concept of heat syndromes?
Pathological change in body which is caused by heat, pathogen invasion, or
Okay.
yin shu and yang shi.
Very good. Yin Shu. Wow, talagang Mandarin siya. Okay. Sige na, sana all. For those who are okay. Yin deficiency or yin shu, yeah, yang shi. Okay. Ang galing. Next, what are the causes of excessive heat syndromes?
Pathological change in body which is caused by a heat,
Okay.
pathogen invasion.
Okay.
Teka,
What else?
exterior heat, summer heat, fire pathogen invasion, cold
Okay.
seam transformation to
Okay.
heat prone,
Yes.
emotional change,
Yes.
proper diet, too
Okay.
much sexual activity.
Yes. What else? I have a question. Can cold turn into heat?
Yes po.
Very good. Okay, let's summarize. It's basically the same answer. First is external pathogenic heat or fire nanggaling sa labas. It can cause excessive heat. Second, if the originally cold tapos nag-turn into heat, pagpasok niya sa loob. Remember, nothing is permanent. Cold can turn into heat. Emotional disorder. Emotional disorder can cause chi stagnation. Kaya if you have a patient comes in with emotional issues, isipin mo kaagad yung chi stagnation because it can turn to heat, no? Kaya nagwawala yung iba dyan, okay? Now, if you have yin deficiency, this cannot house the shen. Then overeating hot spicy food, okay? And also, if you have a yang excess constitution. Next, what are the causes of deficiency or empty heat?
Yin Shu.
Yes. Ano po yung causes?
Ali, deficiency of yin.
Yeah, it's a chronic disease, no? So,
Oh.
ibig sabihin matagal na siya, no? What else? So, chronic disease with yin deficiency and relative yang excess. Kasi nga, hindi na makontrol ni yin si yang. So, to compare, nag-excess si yang, relative yang excess. And second, too much sex. And this will damage your yin essence. Okay?
Mhm.
Yeah. Pasensya na, I don't want you to hear me cough, okay? But now it's productive, so I think I'm getting... Okay, next we go to clinical manifestations of heat.
High fever, likes cold and has an aversion to warmth. 5 heart heat sensation.
Okay.
Red face, red eyes, dark yellow urine, yellow coating. Constipation, fixed sputum.
Okay, what about the tongue? Tongue and pulse.
Sa tongue baka may yellow
Yes.
thing. Yes.
Yeah.
Tapos
Will the tongue be moist or dry?
moist.
No. Heat yan. That's not cold.
Okay. Baliktad pala. Sorry. Tapos sa pulse, rapid.
Okay, you said it all. Okay, anyway, I'll be giving the answer key later. I think everybody got that. Heat, no? So as I mentioned earlier, it's important to look at the tongue. Okay, Ma'am Erdeles Gonzaga, can you take care of number 51 to... Ma'am Erdeles, are you there?
Yes po, Doc.
I'm sure you're also quite ready for 51 to 75. And then see Ma'am Mary Jen, the Desma. I hope you don't have a patient now. Good evening po. Can you take care? Are you there, Ma'am Mary Jen?
Yes po, nandito po.
Okay, very ready for 76 to 100. And we're done.
Sure po.
Thank you
you.
po.
Sure.
Next is, I thought this is exciting. False excess syndrome.
In some extreme cold or heat syndromes, there are some false symptoms or signs which are not the same as the true property of the syndrome.
Okay. So if this is not excess, it could be true deficiency, right? So what do you think would we expect from the pulse and also the pressure? Okay.
Mm,
So
deep.
abdominal fullness will feel better with pressure. Mas nasasarapan siya if you apply more pressure. And then deep, kasi ano diba? Deep wiry pulse. Okay? Next, false deficiency syndrome. So it could be true excess syndrome. How do you differentiate? By
False,
listening to the speech.
false deficiency symptoms, bali dislikes speaking, listlessness, deep
Yeah,
and
this
slow pulse.
okay. Pero dislike speaking, but when he speaks, the voice is very loud and rough. Kaya true excess yan. Di ba?
Mhm.
Yes. No appetite. Tiredness is better after movement. So that means it is excess. So when you move your bowels out, you feel better. That's excess. Fullness in the chest, which is worse with pressure, and the pain is fixed. Next, what are the exterior heat manifestations?
Fever, slight aversion to cold, dry mouth, slight thirst, sweating, nasal congestion with yellow
Okay.
sticky discharge, sore throat, red tongue, floating, and rapid pulse.
Very good. What about the coating on the tongue?
Tongue, medyo yellowish.
Okay. It could be thin. Remember, exterior pa to ha. Exterior pa to and heat. So it's not thick. You
Mhm.
follow? Pag um pag nag-interior na yan, makapal na yung coating. Do you get it?
Yes
So
po.
thin white dry coating or thin yellow coating. So if it's thin white but it should be dry kasi pag moist hindi yan exterior heat. Okay? So yan. Thin kasi nasa exterior pa. So pag kumapal, so what are we trying to prove here? So when you're trying to treat a patient, yung makapal na coating dapat numinipis. Okay? Kung lalong kumakapal, so lalong pumapasok sa interior. And I'm
Mhm.
very, very happy because someone sent me pictures of his tongue. I don't know if he has a background already. I think so he really loved the practicum kasi pinakita niya yung ano niya, numipis yung coating talaga. He was so happy. Next, let's go to the manifestation. So this time from exterior we go to interior, excess heat.
Red face,
Okay.
fever, coma, irritability, thirst, preference for cold drinking, scanty dark urine, constipation, red tongue with yellow coating, rapid pulse.
Very good. So you all got that. So kung nakikita nyo, hindi thin yung coating. Yeah, hindi na siya thin. Actually, thick yan. Doesn't have to be thick. Basta hindi siya thin. Okay. Kung white man, so it should be dry. So hindi po normal ang dry white coating, thin white dry coating. Hindi rin normal ang thin yellow coating. Okay? So rapid pulse. So rapid pulse, so heat na heat yan. What are the manifestations of interior deficient heat or empty heat? Interior empty heat.
Afternoon fever, low-grade fever, night sweats, malar flush, red tongue with scant coating,
Okay.
rapid pulse.
Very good. Actually, minsan, wala na siyang coating. No? Because this is empty heat. But normally, meron pa natitirang coating lalo na sa posterior third. Okay? Yun. Very good. Okay. Okay, we have a diagnosis called true cold and false heat. What are the manifestations here?
Fever, but with desire, floating redness on face, thirst with preference of warm water,
Okay.
large and forceless pulse.
Okay, how are you going to differentiate? Like, you're confused. Okay. Um, Ano ba to? This is true cold, ha? What is the first thing that you will do? Flush yung face, pagkatapos yung pulse niya, forceless. So between the tongue and pulse, where would you rather go?
Yung
The tongue, right?
tongue. Oh, tongue.
Tongue, look. Pale tongue body with white coating.
Mm. Oo
But
nga.
take note, the pulse, large and force. Pagka large pa lang niya, malaki. Forceless. Okay.
Oo.
Oh, cold clammy limbs, na-confuse ka. Why? So, this one is, of course, you'll have cold, calm, clear and profuse urine. Okay, pero, yeah, fever with desire for warmth. Tapos, flushed ang face. Okay. And then
Mm.
thirsty siya, prefers. So, ibig sabihin, you just don't rely on what he tells you. Okay? There are some people, they prefer hot drinks, even if they're not. Yeah, sorry. They love hot drinks pala. Oo. Pero,
Sanay na.
they're thirsty, sanay na. Okay, so sanayin na natin. Next, what is the pathogenesis of true cold, false heat? So again, Sir Victor, where do you look? For like, you want to know if it's really true cold, false heat. What is our basis? The tongue, right?
Mm.
Okay.
Tongue.
Now let's talk about the pathogenesis. What happens here? Like, how does the pattern develop?
Internal exuberance of yin cold, which drives declining yang outward.
Okay. Iniitsapwera na niya. So naging cold na. Okay? Makes sense?
Mm.
Oh, nag-dominate na si cold. Next. Are you getting more confused? True heat and false cold manifestations. Wow. Actually, there are many patients who are like that. Kaya I always emphasize, it should always be the tongue. Okay?
Mm.
Always be the tongue.
Cold limbs, but aversion to warmth
Yeah.
and burning sensation in
Yeah.
chest, abdomen. Deep and rapid pulse. Red tongue with black and dry coating.
Okay. What else?
Deep, rapid pulse. Severe thirst with preference to cold drinks.
Okay. Okay. Very good. I hope everyone got that. Okay. Next, what's the pathogenesis of true heat with false cold? Opposite lang to kanina, di ba? True cold with false heat. Ngayon, true heat naman, what happened here? True heat with false.
Internal
Yes.
exuberant yang driving yin outward known as
Nasinita si Yin.
exuberant yang rejecting yin.
Okay, very good. Number 40. What are the manifestations of exterior cold? Let's start with the tongue, then the pulse.
So, thin, white and moist coating,
Very good.
then floating and tight pulse.
Very good. What else?
Serious aversion to cold,
Mhm.
mild fever with no sweat, headache, body aches.
Okay. What about the nasal discharge? Anong kulay?
Ano ba to? Ano yan? Light?
Yeah, thin white nasal
White.
discharge. Very good. Number 41. What are the manifestations of interior cold?
Intolerance to cold, cold limbs, pale complexion, deep, slow pulse, pale tongue with white moist coating.
Yeah, you see it's faster when you look at the tongue first, right?
Mm.
Yeah.
Profuse, Saliva.
Alam nyo ba, the reason why I wanted to do on September 16 and 17, this is not the usual spoon feeding type. I would like all of you to, I'll probably give you an assignment so that all we need to do now is discuss. No, it's not the usual. Okay, yung ganun. We'll try to see, like we do it this way. Okay, if it's okay with you. And I feel that it's better this way. You're just like lung and large intestine, spleen and stomach. Ay nako, lung and spleen, then the large intestine and stomach, they are related. That's why I love those four. So that's basically ano to? Taiyang and Yangming. Okay?
Mm.
This time, you will be able to master the tongue and pulse. So we hope you could invite other people. And it's something that has never been done before. So are you good? Okay. Next. What are the manifestations? Paulit-ulit lang, no? Exterior heat. Let's start with the tongue. Cervix.
Red tongue, tapos floating rapid pulse. Kasi heat eh. So may fever, slight aversion to cold,
Okay.
dry mouth, slight thirst, sweating,
And
congestion with yellow,
yeah, the nasal discharge will be yellow. Yellow and sticky. Okay?
sore throat.
Yes. Interior heat manifestations.
To high fever, thirst, yellow scant urine. Teka, ano pala? Yellow coating sa tongue, tapos deep pulse.
Yellow
So,
lang. Is it yellow and what? Moist or dry?
teka, heat,
Heat yan.
dry.
Yes, dry.
Tapos,
Okay. What do deficiency and excess show the condition of? Bakit natin sinasabi excess or deficiency? What really are we referring to?
it generalizes various syndromes due to exogenous EPIs or accumulation of pathogenic factors inside the body.
In short, the APF and the PF. The anti-pathogenic factor and the pathogenic factor. Yun lang po. No? Number 45. In relation to APF or anti-pathogenic factor and OF,
Yes,
excess shows
full. Pagka
that's PF. Okay, sorry. Excess shows.
full, deficiency
Okay,
shows empty.
what does excess mean? Remember, si pathogenic factor and the Zhang Okay? Zhang is the what's this? The anti-pathogenic factor. E pasensya na dito, this is not OF, that's PF. Are we good? Also, pag sinabi mong excess, what happens to both the pathogenic factor and the anti-pathogenic factor? What do you call the anti-pathogenic factor? The Zheng Qi. The Zheng Qi. Z-H-E-N-G and Q-I. Are they both strong? Are they both weak? Or one is strong, one is weak?
So, pag ano, teka.
Sige, I'll give you the answer.
Yun.
Everyone look here. Okay? Pag excess, pathogenic factor and your immune system are both strong. There is an ongoing battle. Okay, kaya excess. Pag deficiency, your immune system is weak. There is no pathogenic factor. So everything is weak. Kaya deficiency. Pag mix naman, mahina ang immune system or Zheng Qi, and there is a pathogenic factor in the body. Matagal gumaling. Is it clear? That's why I felt that kailangan natin ulitin ito next week. Of course, the questions are framed in a different way. So if I were you, para tuloy-tuloy, sagutin nyo na mamayang gabi. Okay, so yon. Excess, both pathogenic factor and the Zheng Qi are strong. Deficiency, walang pathogenic factor, but the Zheng Qi is deficient. Everything is wala. Ang mixed, deficient, ang Zheng Qi or your antipathogenic factor, and then nandiyan yung pathogenic factor. Pasensya dito, APF and PF yan, ha? Not O. Next, what are excess syndromes? What are the excess syndromes?
Excess syndromes. Pathologic factors or Qi in the body.
Yes, very good.
It has no
Pathogenic factors. CHE, yeah, pathogenic factors. The EPI, very good. What else?
it has no obvious show of body's resistance.
Okay. What else?
And left
What is another excess? There are 4.
says yung Zeng Qi.
Okay. Sinabi mo na kanina. Okay. So aside from the external pathogenic influence, CHE, the pathogenic factor, we have stagnation of qi and blood. That's excess. By this time, you already know the difference between qi stagnation and blood stagnation. Okay, let me ask you, Servi, which is fixed? Blood stagnation or qi stagnation? Which pain is? Both has pain.
Blood.
Very good. I'm happy. Okay. Accumulation of pathogenic factors like phlegm, congested fluid. And number 4 is food stagnation or food stasis. So remember all those 4. Good. What are the causes of excess syndromes?
Exterior pathogen invasion.
Yeah, okay.
Dysfunction of Zang Fu with accumulation of pathologic factors.
Okay.
Hyperactivity of pathogenic factor that cause an excess.
Okay. So we have the so-called 6 climatic factors. We shall be dealing with this, I think, in modules, week 3. And then pestilences, okay? Pathogenic factors attacking and fighting with the Jiang Qi. Imbalance of Zang Fu functions causing qi stagnation, resulting in phlegm, fluids, water dampness, blood, and food accumulation. Okay? What are the clinical manifestations of excess syndromes?
Short-term, strong appearance, agitation, sonorous voice, hoarse breathing, pain aggravated by pressure, rough,
Yeah.
thick coating, excess pulse.
Okay, so meaning to say, pag deficient, it's more chronic. Very good. So tingnan nyo how important is tongue diagnosis here. No? That's rough tongue. That's not tough tongue. Sorry po Rough tongue. Rough, ito matapang. So difficult, thick, greasy coating. Excessive, forceful pulse. Actually, parang sinisipa ka, you know. And did you know that the 4-point needle technique can actually, temporarily can change it? Okay. And I'm so happy that some or most of you have tried using the ear. And of course, the back shoe. Next, what are the main deficiency syndromes? Enumerate them.
Deficiency of body's resistance, the Zheng Qi, with no obvious pathologic factors. Chechi.
Okay, what else? Yang
Tuloy po.
deficiency, yin deficiency, yan na po. Qi deficiency, blood deficiency, body fluid deficiency, and others. Essence deficiency. So these are the main. Actually, when you talk about essence or qi deficiency, parang yin deficiency na rin yun. Okay? Next, what are the causes of deficiency syndromes?
Congenital deficiency, acquired derangement via improper diet,
Okay.
emotional change,
Yeah.
too much sexual activity, or incorrect or delayed treatment.
Okay. You see, improper or delayed treatment. Ha? Baka mamaya hindi nyo alam, nag-deficient na. That's a mortal sin. So, sabi ni Sir Vic kanina, congenital. So, we have a weak constitution. You were born with it. Improper diet, emotional irritation, specifically overthinking and overworrying. Overindulgence in sex, or chronic disease with improper or delayed treatment. That's why we need the expertise of the acupuncturists and also naturopaths. No, vomit, diarrhea, perspiration, and bleeding. These are deficiency syndromes. Thank you so much, Sir Vic.
Ang salamat din po, Dok.
Okay, did you have a hard time? Is everything clear now?
Much clearer.
It will be much, much, much clearer next week. Salamat po. Let's call on Herdeles, Ma'am Herdeles Gonzaga. Good evening.
Good evening po.
Yes. Ano po yung yin syndromes?
51 po, Doc.
Yes, 51.
Chronic disease, living in cold area, transmitted from Qi deficiency, elderly people, overconsumption of cold or raw food, oversex damage, kidney essence.
Okay. In general, tatlo lang. Interior. Pag interior, yin yan. Cold deficiency. Okay, tama yung lahat sinabi mo, but this is a more generalized. No? It's okay.
Yes
Yang
po.
syndromes. Opposite lang nung kanina. Okay. What are the yang syndromes, please?
Saglit po.
Sige, okay lang po.
Ang wala akong sagot, Doc.
Sige, okay lang.
52.
Exterior, heat and excess. Oo, salamat Sir Andy ha. I will never forget. Parang nagiging ano yung ang boses ko. Yeah, I'm so grateful. Siguro talagang dapat lumabas yung flam. And I think he's here. He just messaged me. Hindi ko nakita. Salamat po. I will never forget this, Sir Andy. Nako. Yeah. Pero wala siya yata. It's not here. It just said help. Okay.
54 na po yung nasagutan ko pala, hindi ko nakita
Sige
yung
lang po. So
53.
what are the causes of ito yung sinagot mo kanina. What are the
Yun po
causes of
ba?
yang deficiency?
Sorry po, Doc,
Yeah,
na
what can
nalito
cause
ata ako
yang
sa number.
deficiency syndrome? It's okay, no problem. Okay, do you have an answer here? So these are the answers. Chronic
Yun po yung hindi
illness.
sinabi ko kanina.
Kaya yung iba matagal na yung problem, hindi gumaganda-ganda, kailangan nyo ng tulungan. Chronic diseases. If you live in cold areas, okay, it can transmit from Qi deficiency. Remember, the difference between Qi deficiency and Yang deficiency lang is the presence of cold in Yang deficiency. Elderly people, kaya nagbabalot na, lalo na pupunta ng Baguio. Overtaking cold, overeating cold, that's not overtake, overeating cold and raw food, okay? Overeating. And too much sex. So remember that. Not too much, huh? Lalo na if you're not young anymore. Number 54, clinical manifestations of yang deficiency.
Pale complexion.
Let's start with the tongue.
Pale, enlarged tongue.
Yes, very good. And
Deep,
what about,
slow, deficient pulse.
okay, yes. So what are the other
Then
manifestations po? Yang deficiency.
pale complexion,
Okay,
intolerance to cold,
yeah,
cold limbs, tiredness, fatigue,
yes,
palpitation, and spontaneous sweating.
yes. Everything follows. Number 55. Ano naman ang causes ng yin deficiency syndrome? Earlier, we talked about yang deficiency.
Chronic disease, especially
Chronic.
warm diseases,
Yes, what else?
damaging body fluids,
Okay,
emotional irritations,
yes,
oversex, overconsumption of hot, dry food, damaging body fluids, and yin.
very good. Clinical manifestations of yin deficiency.
Mm. Malar flash,
Ay, let's start with the tongue.
red tongue, body with scant coating,
Okay, scan coating. And the pulse?
def- deficient, ready, rapid pulse.
Yes, very good. So what are the other symptoms? Continue.
Malar flash,
Okay,
emaciation, dry mouth and throat, night sweats, and tidal fever.
very good. It's all there. What is yang exhaustion? Naubos na yung yang.
Severe condition due to yang qi severely damaged.
Wow, very good. What are the causes of yang exhaustion?
Progress through yang qi deficiency, excess yin, cold pathogen damages yang qi of the body.
Very good. Clinical manifestations of yang exhaustion. Let's start with the tongue and pulse.
Pale and moist tongue,
Very good.
floating rapid empty pulse,
Yes.
or feeble, ready, barely palpable pulse.
Okay, other manifestations.
Cold sweats heavily, cold, cold extremities, weak breathing, pale complexion, pale and moist iron, pale
Okay.
and moist tongue.
Thank you very much. Number 60. What is yin exhaustion?
Severe and life-threatening condition due to massive loss of yin and body fluids.
Very good. What are the causes?
Sa tongue ulit.
Of
Ay.
course.
Chronic illness with body
Yeah.
fluid deficiency.
Yeah, obviously walang-wala na ang coating nito. Sige, sige. What are the causes? Causes ito, wala ng tongue.
Yung nga po,
Tongue.
chronic illness with body fluid deficiency, body fluid severe consumption due to high fever for a long time,
Okay.
severe vomiting or diarrhea, profuse perspiration,
Yes.
burns, and severe bleeding.
Okay, very good. So you have to ask these things. Okay? Siyempre, pag may burns, nauubos yung fluids. Okay, 62. What are the clinical manifestations of yin exhaustion? You start with the tongue and pulse, please.
Dry lips and tongue,
Okay,
ready and rapid pulse,
very good. And what are the other symptoms and signs?
hot, sticky, and salty sweats,
Okay,
hot body and limbs, irritability, aversion to heat, extremely thirsty with preference of drinks, withered skin, scanty urine.
okay. So, lasahan nyo yung sweat, ha? Kung maalat na yung sweat, that's yin exhaustion. Okay, what is yin predominance and yang insufficiency? So
Cold.
excess is, yeah, okay. Yes,
Cold.
very good.
Cold po.
And what is yang predominance and yin's insufficiency?
Heat.
Great. Causes of cold pattern. Again,
It's due to yang insufficiency, the cold of deficiency type, yin predominance, the cold of excess type, invasion of the body by a pathogenic factor cold.
Very good. Signs and symptoms of cold pattern. Let's start with the pulse and tongue.
A pale tongue with moist white
Of
coating,
course, the pulse
slow
is
or tight pulse,
very good. So what are the other symptoms and signs?
aversion to cold, preference for warmth, absence of taste in the mouth, lack of thirst, a cold limbs, desire to lie down and curl up, clear and long urination,
Okay,
thin, loose stools.
very good. What are the key cold signs and symptoms? Analysis. The cold, not thirsty, and pale. So, ano to?
Aversion to cold limbs, desire to lie down, the body is unable to maintain
Okay, the
its
not
warmth.
thirsty.
Yun po.
Yung not thirsty, how can you account for that? Hindi siya thirsty pag cold. Because mayroong tastelessness in the mouth. Yin
Okay
cold
po.
is exuberant, fluids are not damaged. Ang pale naman, they look pale because of excessive secretions. Pale tongue with moist white coating. Deficient yang, fails to warm and transport fluids. Next. Causes of heat pattern naman.
Hmm. The heat of excess type is the yang predominance.
Very good.
Tama po ba, Doc?
Yes.
Yin insufficiency, the heat of deficient type.
Yes.
Invasion of the body by a pathogenic heat.
Very good. Signs and symptoms of the heat pattern.
Hot body that prefers to coolness.
Ay,
Yang,
ano na, tongue. Tongue and pulse.
atang. Red tongue, rising and scorching of fire heat.
And the pulse.
Rapid pulse, heat
Very
causes
good.
the blood to move more quickly.
And then symptoms and signs.
Hot body that prefers to coolness. Dark urine, thirst, preference for cold drinks, consumption of yin fluid, red
Okay,
face,
very good.
dry stools.
Let's analyze the signs and symptoms of heat. Let's start with the hot body that prefers coolness. Ano ang cause nito?
Hot body.
Okay, let me show you. Yang predominance, di ba? Heat yan
The
eh.
heat.
Okay, what causes the short, dark urine? Maikli lang tapos dark. Preference for cold drinks. Kasi na-consume na yung yin fluids. Remember, heat yan. Okay, red face, red tongue because of the rising and scorching of fire heat. I think you mentioned this a while ago. Dry stools. That stools are dry because there is heat in the intestines with damage to fluids. The pulse is rapid. Heat causes the blood to move more quickly.
Oh,
Okay.
yes po.
Before we proceed to the next one, do not depend on one sign and symptom lang to differentiate whether or not a syndrome is cold or heat. Examine the condition in its entirety. Ask for thirst, temperature preferences, body temperature, the tongue and pulse, complexion, stools, and urine. Okay. Heat above and cold below. Can you tell us about this?
Heat above, suffocation in the chest, bad breath, thirst, nausea, swelling, and painful gums.
Very good.
Cold below, abdominal pain, alleviated by warmth, loose stools.
So your diagnosis is heat above and cold below. Exterior
Yes po.
cold, ano po itong exterior cold, tapos interior heat.
Pre-existing interior heat with invading wind cold in the exterior.
Dati na yung interior heat. Okay? Number 73. Exterior heat and interior cold.
Progress through yang qi deficiency. Excess yin cold pathogen damages yang qi of the body.
Okay. Great. Okay, the conversion of cold and heat depends on
relative strength of the pathogenic factor and upright chi, hyperactive yang chi. It's called to heat.
Okay.
Unsuitable treatment, too much yang tonics. It's called to heat.
Okay.
Constitutional reasons, deficient yang. It's heat to cold.
Severe na. Okay, very good.
Severe na po.
Okay, ano po yung true heat and false cold?
Extreme heat appearing as cold. Internally true heat, external false cold.
Signs
Sign and symptoms, cold hands, feet, hip, pulse, but hot body. No aversion to cold, but aversion to heat. Thirst with desire for cold beverages, irritability, scanty, dark urine, rapid forceful pulse, and red tongue.
Okay. So this is one situation in which you need to really look at the pulse and tongue. Okay. Maraming salamat po, Ma'am Erdeles. And
Thank you po, Doc.
congratulations. I knew that you have studied really hard. So far, so good pa.
Thank you po.
Isa pa next week, no? Okay.
Yes po.
Maraming salamat.
Na-attend na po ako lagi.
Okay. Okay. Ma'am Mary, thank you po. Congrats. Good work.
Thank you po.
Ma'am Mary Jen Ledesma, good evening po.
Good evening, everyone. Good evening, Doc.
Yes. Okay. Good evening. Let's ano po itong true cold and false heat? First, you have to describe what you see in the tongue and then the pulse.
Meron ako dito, sluggish body. There's, hindi ko na ano yung tongue. Yes,
Okay, can you describe anong appearance ng pasyente dito?
appearance, extremely cold.
Yeah.
As heat. So, appearing heat. Para siyang,
Okay.
yes, Doc.
Yung itsura niya mainit, pero ang feeling niya cold.
Malamig.
Imagine, no? May mga ganun, di ba? I think somebody from your batch, or was it the other batch? There was a patient daw. Yeah, first batch. Batch 1. Sabi niya, mapula daw yung mukha niya. Tapos, malamig naman yung ano. So, what will be the basis? Your tongue and pulse. Okay? Yeah.
Pulse.
Next.
Floating pulse. Yes.
Yes, floating pulse. Very good. False signs and symptoms are usually in the, okay, like ito yung ano natin. So where do the false signs and symptoms usually manifest?
The limbs and the skin. Yung
Yes,
ilang
very
isa
good.
nila.
Or the face.
Or the face.
Okay, yung true signs and symptoms, saan nakikita?
Sa deeper layer po. So, straight. Yung lakas ng pulso niya.
And then?
So, and sa appearance niya, sa temperature of the chest and abdomen, and sa urine.
Okay. You know, I really appreciate na nagbasa po talaga tayo. And I think naman, no, kompleto yung ating mga references. Number 79, can you tell us, ano po itong deficiency and excess? Like, how do you define each? What are we trying to
principles. Yung mga first ng principle niya, ma-determine mo yung nature of diseases.
Okay.
So, the pair of the principle reflect the relative strength, presence of the pathogenic factors, and upright chi.
Okay. So,
vital factors.
Yeah, very good. So, earlier, diniscuss natin yung deficiency, excess, and mixed deficiency. Can you repeat the definition? Deficiency.
Deficiency. Deficiency means pagkakaintindi ko, kulang siya. So, deficient.
Empty ang upright chi.
Yes.
Gen chi.
And then
Wala ring pathogen.
Yes. Yung isa naman is full, yung excess. Pagka-mix, so halo siya, matagal siyang bumalik.
So, yes, excess naman, presence of pathogen, and normal yung upright chi kasi may nangyayaring gyera, di ba? Mixed deficiency and excess, mahina yung upright chi, tapos may pathogen. Okay?
Yes.
Now we're clear.
Yes,
Next, what are the causes of deficiency pattern?
Deficiency pattern number 80. Efficiency of Qi blood, yin and yang. Qi and blood deficiency, short course, less severe. Details will be discussed in Qi blood and body fluid
Okay.
pattern. So, yin and yang deficiency, chronic siya
Okay.
and severe.
Okay, yin and yang deficiency. You only diagnose yin and yang deficiency if it is severe and chronic. Okay? Qi and blood deficiency or qi and blood insufficiency if it is quite new, quite recent. Now you see the difference? Because qi is under the realm of yang, blood is under the realm of yin. Are we clear? So
Yes.
it takes time for your yin to be deficient because mauuna mo na yung blood deficiency mo. Okay? Hierarchy yan eh. Diba? So, chronic and severe yin deficiency and yang deficiency. And I'm sure you are all good at diagnosing already. So, pag shorter course, less severe, and we will discuss this sa mga, like we have a pattern according to chi, blood, and body fluid. Hindi na natin muna di-discussion dito. Good. Now, let's go to the signs and symptoms of deficiency pattern.
81. Tama po ba? Number 80. Tama po ba?
81.
81. So 81 deficiency pattern. This depends on what deficient. So, tiredness, desire to lie down, weak voice, parang ako lang. Weak pulse.
Yes.
So,
Everything
basic-
is weak. You want to lie down all the time. You're tired. Your voice is weak. You don't want to give lectures. Yeah. Alam niyo ba na we're all training you to become excellent lecturers?
Mm, Yes,
It's only when you become a lecturer, when you become a very good clinician. I hope everyone agrees with me. Yan pa. Maulit-ulit yan eh. Okay. Yun ang dream ni Doktora Palanca. So if you can lecture all the time, and of course, we cannot be doing this all the time. I'm getting old. But anyway, matutuwa na siguro si doktora niya. Okay? And hopefully in the future, we can align ourselves with the medical counterparts. And they look at us with high respect because we are called medical acupuncturists in the true sense of the word. Okay? Love. Okay, so let's build a global brand. Yabang, no? Okay. So, kung gusto natin yumabang, we have to work hard. And I hope, I'm so, even if dalawa lang kayo, tatlo, you notice, kahit one time it was doktora lang, isa lang, but I understand. You can always watch this naman at your own convenient time, no? Nauso na kasi ngayon streaming. You just have to pass the exams. And by the way, assessment tests are more difficult than the actual exam. You may have heard the batch one. I think the last time 9 got a perfect 100 out of 13.
yes.
So yun, ganun sila
Batch.
kadali. Okay. Okay, so andito na po yin deficiency, yang deficiency. And I'm sure everyone is familiar with this. Now let's go to the causes of excess pattern.
Access pattern. 80, what numbers are 82?
82.
Yes, 82. So, yang predominance, heat excess type.
Okay.
So, yin deficiency, heat deficient type.
Okay.
So,
Always remember,
in
pag excess, there is a pathogen plus the upright chi or your immune system is strong. Okay? So there is accumulation of the endogenous pathogen like phlegm dampness, water dampness, blood stasis. These are all excess. Next, signs and symptoms of excess pattern.
82, sir. Ano?
Yes, 83 na.
Yes. 83 na. Okay, 83. So it's acute or onset. Allegation, loud voice, coarse breathing, pull in the chest and abdomen, pain aggravated blood pressure, constipation, rough and painful urine, or DB. Yun po.
Okay, if you notice, tingnan nyo ha, yung coating talaga niya makapal, no? Do you get it now? Okay? It can be acute. Kaya pag acute yan, excess yan. And then, remember, the upright chi is strong. So if you're a good therapist, a good acupuncturist, you would expect the coating to be thinner. Okay? Until your patient will eventually be conscious about how the tongue coating looks like. That's what we want to achieve. And nako, if you do that, ano na yung dream ni Doktora? Medical acupuncture. I'm serious, Number 84. What are the key points to distinguish deficiency and excess?
Body types, voice, breath, manifestation, whatever abrogated by pressure, tongue coating, pores of pulse.
Okay, let me ask you, like length of disease, which one is more of a longer duration? Deficiency or excess?
Deficiency.
Very good. So I don't have to ask more. Next, let's talk about the mixed patterns of shu and she. Yun ang gusto ni ano na pronunciation ni Sir Vic. Pupunta yata ng Beijing or Shanghai or pupunta siya doon sa West Philippine Sea. Sorry. Okay. What is this po, Ma'am Mary?
Yes, a complication of deficiency of upright chi, vital substance with present of pathogen, exogenous or in.
Yeah. So this one is really complicated.
Yes.
So tingnan nyo ha.
Exterior deficiency
Yes.
and interior excess. So yun.
Okay.
Andito na po lahat.
Sa totoo lang, if you know these things, you won't be surprised anymore. So exterior deficiency interior. This is possible. This is a diagnosis. Okay?
So,
Huwag niyong ano lang, okay, guessing, gawin ko na lang itong ganito. No. Next. Now, what about this? Excess nag-transform into deficiency. Can you tell us about it? What causes it? Yung excess naging deficient tuloy.
for example, Doc, yung halimbawa onset, naging chronic na siya kasi lack of treatment. So, incorrect treatment.
Yes. Incorrect. Lack of treatment.
Yes po.
Na-expel mo yung pathogen kasi pinalis mo lang, pero na-damage na yung upright chi. That's why your module 6 is treatment principles, no? And that's actually the most game-changing module. This is where you like compress everything. Ay, oo nga pala, no? Everything like, they should have known these things. Okay. What about deficiency na naging excess? What happened here?
Parang feel ko nabawasan. Pero let's see, yung question, answer ko po is efficiency of RPG is unable to transport and distributed, causing the production of indigenous
Actually,
pathogen.
a
Flesh.
very good example is yung spleen chi deficiency mo, di mapel yung tongue. Then all of a sudden, naging excess, naging phlegm. So, ibig sabihin, engot ang therapist. Okay?
Yes, so,
I'm
kaya
sorry,
hindi
but
pwede
we have to
magkamali.
really, show this to the world, what we know what we're doing. True excess with false deficiency.
An excess pattern is accompanied by false sign of deficiency.
Okay.
Example, false sign caused by the pathogenic heat,
Okay.
the black, the cheap low.
Yes. Yes. So it's actually secondary, di ba? Oo. Binlock niya yung chi flow sa extremity. So nag-cold. And it takes a very good mind to discover this. Next, true deficiency, false excess.
Deficiency pattern is accompanied by false sign of excess. Example, falseness in the pain and abdomen. False symptoms of excess caused by deficient. Spleen chi, unable to transport and transform food and things.
Very good. So, distinguishing between true and false deficiency and excess pala yung excess yan, needs careful examination of what? Napansin nyo, it's all about signs and symptoms together.
Yes. Yes,
91. Ano po ito? Intolerance of
Intolerance
cold, fever with aversion to cold. Okay, una nyo muna tingnan yung tongue and pulse. What immediately comes to mind?
yung mga coating yan.
Tingnan nyo, ano pa lang ha, tongue and pulse pa lang, alam mo na.
It is
Yeah.
exterior syndrome.
Exterior syndrome. Very good. Ito, alternating chills and fever. Kanina yan.
Yes, Xiaoyang.
Yes, or the intermediate syndrome. Intermediate syndrome is so ibig sabihin, the antipathogenic Qi is not strong enough to expel the pathogen because all you did was to remove the bacteria or the virus. You did not strengthen the immune system. 93, interior sorry. Ano po ito? Like, look at the coating.
In yellow. Superficial. So, interior syndromes transported via exterior to interior.
Yeah. Direct
Direct
attack and drastic emotional change. Kaya wag biglang magbago yung ugali. Okay. Di ba, Doc
Parang bipolar? No.
Yeah, that's why we want you to be excited. We're going to do bipolar next time. Okay? And I'll tell you the easy way. Next. Oh, tingnan nyo kaagad yung tongue. What comes to mind immediately? Go.
A cold
White
syndrome.
voice. Very good. Next. Ito na parang nagmamadali na. Red tongue with yellow dry coat rapid. You see, if you start with the tongue and pulse, you would immediately know the syndrome. What's the syndrome here?
A hot syndrome.
Very good. Next. Ano tong nangyayari dito? Usually due to kidney yin deficiency because kidney yin is the foundation for all yin. So what manifestations are we talking about? So
Yin
this is yes, yin deficiency. Ang galing. Now this one, anong pattern to? Anong syndrome?
Heat above, cold below.
Okay. Number 98. Ano nangyari dito?
Cold exterior transforming into heat in interior.
Okay, very good. Number 99.
Heat transforms to cold.
Yes. And finally,
Through heat, false cold. So heat interior, false cold on exterior.
okay. So thank you so much for joining.
Thank you.
I hope everyone is happy. Thank you so much, Mary Jen.
Thank
It's
you
good to
po.
see you back.
Thank you.
I can see some inom doon ng salaba. Thank you po, Ma'am Betty C. Uminom ako ng kape at salaba. Okay, sige po. Thank you. Thank you so much for your concern. Maraming salamat. I hope everybody felt better. So, sa una lang po yan mahirap. Sa totoo, nanihirapan pa rin ako ngayon, lalo na yung mga mixed patterns. No? So, it's really, really important that we spend another week on what's this? The 8 principles. Kasi yan po talaga ang main na pattern, differentiation. Maraming salamat, everyone. I know you're all hungry and you're all excited. And si Ma'am Mary Jen is also having parang may bara din yung ilong, no?
May sakit po ako, Dok, ngayon, Dok. Kaya nakapasok.
Hindi masyadong halata. Okay.
Hindi ako nagbubukas ng camera masyado. So yun po, thank you so much. At least may opportunity.
Yes, thank you. And I hope you can join us again next week. You are also free to join batch 3, huh? For your anatomy. And remember, their anatomy is different.
Yes po, Doc.
You never repeat. Okay. Maraming salamat po, everyone. Good night. And
Thank you, Doc.
God
Good
bless
night.
you all. Sir Vic, sino
Good
pa?
night.
Or the less. Good night po. Maraming
Night po.
salamat. Good night, everyone.
Night.
God bless. Stay happy. Bye-bye.